So a lot of you may know that I have hereditary angioedema. If you were going to the summit, I'll see you there because I'll be there and also passing out the t-shirts or doing some volunteering. But a lot of people always ask about my medications. So I would like to review all about my medications and actually all the medications that are out for hereditary angioedema. So let me take you on my journey of medication. So I was diagnosed in 2012. And when I was diagnosed, it was May 22nd, 2012. My twin and I both found out that we both have hereditary angioedema. So I initially just started on medication. My twin wasn't having any symptoms yet, so she wasn't on any medication. The first medication I tried was Cinryze, okay? That's the first, the real first, medication of its kind of a C1 esterase inhibitor product, okay? I'll never forget walking in, being 22, and I was going into my senior year of nursing school, and the doctor came in and said, "You have this disease and you will have to do IV infusions for the rest of your life." And I will never forget crumbling on the floor, literally breaking down, what? I had to do IV infusions for the rest of my life? And now, look at 11 years down the line, look at me now. But anyways, so I started on Cinryze. That was a medication it was a C1 esterase inhibitor product. And it was the first prophylactic treatment. So it was to be administered IV every 3 days, okay? I tried on that medication for several years and eventually my body became tolerant to it. Even though they say it doesn't, I feel like it does. Personally, for myself, I'm only talking about my experience. I cannot speak about anyone else's experience, okay? So Cinryze is the first medication. Usually a lot of patients aren't on that anymore. The next medication is Kalbitor. So Kalbitor is a medication. This is the injections that I do in my abdomen, okay? So those are 3 separate subcutaneous injections. They have to be administered at least 2 inches apart. So that's why you have to space it out. You administer them all at one time. If there's no relief in your symptoms, you're still having a lot of symptoms, you can redose in 45 minutes. But the dosing is in a 24-hour rolling time span. So for example, if I administered this medication at 2 p.m. and then I got sick again at say 9 p.m., I give the injections at 2, I give the injection at 9. I cannot receive Kalbitor again until 2 p.m. the next day. So that's what I mean when in the rolling 24-hour time, okay? So you have to do 3 separate injections. This medication works on the production of kallikreinin to stop leading to bradykinin. So it is a different type of mechanisms compared to Cinryze, Berinert, which is a C1 esterase inhibitor, okay? So that's Kalbitor. This medication must be administered by a healthcare provider. Fortunately, since I'm a nurse and my twin's a nurse, I've gone against my health insurance and actually been able to administer it at home. But there is a 1% chance of allergic reaction. Therefore, it needs to be administered by a healthcare provider. So it's not the most ideal medication for a lot of patients. I've been on it for 11 years. It works great for me, so I continue using it. A lot of patients don't try this anymore. So the next medication I'm not on is Firazyr. Firazyr, I'd like to say that this is an on-demand medication, and how much it costs is $8,000 per dose, per round. I know. Okay. The next one is Firazyr. Firazyr works similar to breaking down kallikreinin, okay? So that works with the breakdown of kallikreinin that converts to bradykinin. Kallikrein that converts to bradykinin. Sorry. So what it does, it's an injection that you can give once every 6 hours. If you don't see improvement, then you can redose. So it's an injection you can do yourself. It's a subcutaneous injection. You usually want to do it at the first onset of symptoms. So if you start getting a tingling in your mouth or you're about to swell, that's when you should start your Firazyr. Another good thing about Firazyr is it does not have to be refrigerated. On the contrary of Kalbitor and Cinryze, both have to be refrigerated. Firazyr does not need to be refrigerated, and you can administer it as a subcutaneous injection. The thing is that you have to administer over 30 seconds, okay? You can't just push it in. Also, it's a larger volume, and the medication stings really bad. I personally did try this medication and I failed it. It caused increased elevated LFTs. That is one of the side effects, is increased LFTs. So that's why I stopped doing it, because every time I was on it, it would increase it, and I also had a really bad localized reaction. So that is Firazyr. It does not need to be refrigerated, and it's just one syringe that you have to do compared to 3. The other medication is that is for on-demand, like so when you're having an attack. The other medication is Berinert. That's the one that you see me mixing up. This medication. I know it should be in the boxes, and because it just comes with so much boxes, I break it down and put it into bags. So this is Berinert, okay? And then I have the sterile water. For me, I've been using Berinert as like a maintenance med, so I do like a daily infusion. And then when I get sick, I can use this on demand as well, or I can use Kalbitor. So with this medication, it is it's made from human plasma. Okay, so that's one other thing that some patients may not like, so that's important to let them know. It is made from human plasma. You have to reconstitute it. So that means when you have the sterile water with a mixed Q vial into the medication. To describe, for example, is this. And this medication needs to also be refrigerated. So, for example, blue to blue, here to Berinert, underneath, okay? It's going to mix down, and then you have to roll it gently. Never shake, especially any of these products. You never want to shake it, especially because you're going to break down the product. Like, you can literally break the particles. We don't want that. I want all my plasma. Don't break it up, okay? So you want to roll it slowly. You want to make sure that the medicine mixes thoroughly and there's no clumps. You want to make sure it's clear and everything. So this is administered IV. So intravenously, I have a port. You can do it through a peripheral. But you need IV access. So that is a drawback to this medication. Another thing is how it's administered. It's 4 milliliters per minute. So every minute you'll see me put the timer on, and that is so I can push 4 milliliters, reset my timer. Push 4 milliliters, 1 minute's up, reset my timer. And it goes by weight base. So for me, I use 1,500 units. So that can be a little difficult, especially on weight. So it depends. So it's 20 units per kilogram, okay? So you have to convert the patient's weight to kilograms. Then you have to multiply 20 units by their kilogram, okay? For me, it's 16,000 units, okay? If you do the math. Well, each vial is 500, okay? So I'm going to do 3 vials to get 1,500. It depends on your health insurance if you go up, down, so there's all things you have to change. So that's administered 4 milliliters per minute, okay? The next medication to go over is maintenance medication, which can be Haegarda. Haegarda is a C1 esterase inhibitor product as well. This medication is actually administered subcutaneously. So it's exactly the same thing as Berinert, as this, but in a subcutaneous dose, okay? So I just started on this. I'm trying. I think it's going okay. This medication is administered subcutaneously, so in your belly, okay? And it goes by the units per kilogram as well. But this medication is administered every 3 days subcutaneously. So for me, that would be 12 milliliters of viscous right into your belly. And it is extremely painful. So what I'm doing with my doctor's discretion is I'm doing a small dose every day instead of doing a larger dose every 3 days to try to see if they'll give me better coverage, okay? So the positives with Haegarda is it has a longer half-life compared to the Berinert. So it's going to stay in your system 39 hours or so compared to like 16 to 18 hours like the Berinert. So this will stay in your system a lot longer. So it's administered subcutaneously every 3 days. It's exactly the same thing with sterile water in the plasma to open it. They come in the vials depending by your weight. It's the same thing. So if you're a little bit of a fluffier person, the weight is going to be hot. The kilogram number is going to be higher, which will mean higher units, which means larger volume. So it can be very painful. Okay? So sterile water, you mix it, and you can administer it in a subcutaneous infusion and slowly infuse it over time. The slower your body you infuse it, the less irritation to the skin is what I do. And then the medication everyone wants to know about. Takhzyro, lanadelumab, okay? I've tried it, yes. And you know what? I remember when lanadelumab was in the clinical trials and reading about it. And I wished it worked for me like everyone else, but it didn't. It didn't. It actually made me really sick. And it made my twin really sick. So maybe it was something with our DNA that didn't work well. I don't know. All right. Takhzyro or lanadelumab is an injection. It's a prophylactic medication. You take a subcutaneous injection every 3 weeks. Every 2 weeks. Okay. And it can significantly decrease your attacks. I've seen it work miracles for others, and I'm so proud and happy it works for you. But it did not work for me, affected my eyesight. I was the sickest I've ever been. I couldn't work. I couldn't get out of bed. I had no energy. I was swollen. It affected my eyesight. It was bad. And then I went to San Diego and they told me, don't do that no more. We'll take you off. So no more Takhzyro for me. Has great benefits. It works on the same, it's like a monoclonal antibody. It's an injection that you do every 2 weeks. And then you if you're going to a maintenance phase where you're not having any attacks, you can actually do once a month injection. It can be really easy. You can do it at home. It does have to be refrigerated. Just to go over that, Takhzyro has to be refrigerated, but Haegarda does not need to be refrigerated. But Firazyr does. No, Firazyr you don't need to. Okay, so many options. Okay, so the Takhzyro works on like the production of kallikrein and bradykinin. So it works in a different pathway than Haegarda. Okay, and then there's a couple more medication. The first ever oral is Orladeyo. So this is the medication to be taken every day. I take it at nighttime. It's recommended to take in between meals. Not in between meals. Let me say that again. You start eating and in the middle of your meal to take the medication because it can make you very nauseous. So that's why. So this medication you take every day, it's supposed to decrease your attacks. I've been on it. I'm not sure exactly if it's helping me, but I've been on it for a while, and this can be beneficial for people who don't want to do any needles at all. Maybe they can just do an oral and it'll decrease their attacks. And then the last medication that I haven't gone over in because I'm not on it because I'm allergic, is Ruconest. So the last medication is Ruconest. It's a C1 esterase inhibitor product, but instead of being made from humans, it's actually made from rabbits' breast milk. Yes, rabbits' breast milk. In Denmark, they got these big fatty rabbits that get like massages and listen to classical music because happy rabbits produce the most milk. Who'd have known? Anyways, so if you, that's in regards to all the medications. Ruconest is an on-demand treatment. It does not need to be refrigerated. I cannot be, so I administered the medication right when it came out, and we wanted to see if it like would have any effect on me. Every time I administered the medication, I became so itchy from the inside out. I was like, my ears are on fire, my throat's on fire. What is happening? So my doctor tested me to see if I'm allergic to rabbits, and your girl is allergic to rabbits. So no root canals for me because I have a hypersensitivity. So those are the medications, all of the medications that are on market. Just to review them, for prophylaxis medication, administration that is approved for the FDA is Takhzyro, the number one first use. The second, Cinryze, Orladeyo, Haegarda, are all your maintenance medications that you can be prescribed for hereditary angioedema. Now, the other medications for on-demand treatments, just to review, are Berinert, Kalbitor, Firazyr, and that's it. And Ruconest. I just can't be on that. All those medications are on-demand or on-demand treatment. So if you're having an attack, it's to treat your attacks. The thing is, it's so personalized. So what does that mean? You have to work with your doctor. Because what treatment works for me doesn't work for my twin. Or, well, some works for my twin. Or doesn't work for another patient. Or treatments that work great for patients that don't work well for me. So you have to work with your doctor, go by what your provider prescribes you. Do not go by what a girl on Tickety Talk or on YouTube says. Go by what your provider prescribes. But just a little overview about hereditary angioedema and the medication itself. So if you have any questions, I guess drop in the comments and I'll try to answer them. And yes, I've been on all the medications. I would like to say I've been on a variety of all the medications. I've tried everything and anything to help me. So if you have any maybe answers, I recommend. Thank you. Mm-hmm.